Hey Emma, you look deep in thought. What's going on?
Oh, hi Dr. Drake. Honestly, I've been feeling a bit overwhelmed. My doctor said I have something called PCOS. I've been reading online and, whew, the information is all over the place. Some even scared me.
I hear you. The internet can sometimes make things more confusing than clear. Let's take it step by step. How about we chat about it today?
Please. I need clarity. First, what even is PCOS?
PCOS stands for Polycystic Ovary Syndrome. It's a condition that affects women, usually during their reproductive years. The name Polycystic Ovary Syndrome comes from the observation of many small, fluid-filled sacs, cysts, on the ovaries. However, it's not just a problem with the ovaries. It's a hormonal and metabolic issue that can affect the entire body.
So that means, what exactly happens in the body?
Think of it like this. Normally, your ovaries release eggs every month during ovulation. In PCOS, ovulation doesn't always happen regularly. Instead, small fluid-filled sacs, cysts, can form in the ovaries.
That explains the polycystic part. Many cysts.
Exactly. But here's something important, not everyone with PCOS will have visible cysts. That's why the name can be a little misleading.
That makes sense. So it's more about hormones and ovulation than just the cysts.
The core problem in PCOS is a hormonal imbalance, primarily involving two key players. 1. High androgen levels. Androgens are often called male hormones, but all women produce them in small amounts. In PCOS, the ovaries produce too much of these hormones. This excess is what causes many of the visible symptoms. 2. Insulin resistance. This is a condition where the body's cells don't respond properly to the hormone insulin, which is responsible for helping convert food into energy. When this happens, the body has to produce more insulin, and these high levels can further increase androgen production.
But how did I even get it? Did I do something wrong?
Absolutely not. PCOS isn't your fault. The exact cause isn't fully known, but genetics and hormones play a big role. If your mom, sister, or aunt has PCOS, you might be more likely to have it too.
So it's in the family sometimes?
Yes. Plus, things like insulin resistance can trigger it. That's when your body struggles to use insulin properly, and that leads to higher insulin levels, which increase androgen production. Think of it as a chain reaction. Insulin resistance leads to high insulin levels, which then stimulates the ovaries to produce more androgens. These high androgen levels disrupt the normal process of ovulation, the release of an egg each month, causing the menstrual cycle to become irregular or even stop. When an egg isn't released, the follicles, the sacs that hold the eggs, can accumulate on the ovaries as small cysts.
Ah. So, it's not just about weight? I've heard people say PCOS only happens to big girls.
That's a myth. PCOS can affect women of all sizes. Yes, weight can make symptoms worse, but slim women can have PCOS too.
I feel better hearing that. You know, before I was diagnosed, I noticed irregular periods, sudden weight changes, and this annoying acne that just won't leave. Could that be PCOS too?
The symptoms of PCOS vary greatly from person to person. The most common signs include 1. Irregular or absent periods. This is one of the most common signs, as the lack of regular ovulation makes the menstrual cycle unpredictable. 2. Excess hair growth, hirsutism. Due to high androgen levels, women may experience thicker, darker hair on the face, chest, back, or abdomen. 3. Acne. Persistent acne, often on the jawline and chin, is another common symptom caused by the hormonal imbalance. 4. Weight gain or difficulty losing weight. Insulin resistance makes it easier to gain weight, especially around the abdomen, and much harder to lose it. 5. Thinning hair on the scalp. The same androgens that cause hair growth on the body can cause hair to thin on the head, similar to male pattern baldness. Finally, infertility. Because of the irregular or absent ovulation, PCOS is a leading cause of infertility in women.
So, all my struggles weren't just me being careless?
No. Your body's hormones were simply out of balance. Many people don't even realize they have the condition until they have trouble getting pregnant or are gaining weight for unknown reasons. It's also possible to have mild PCOS, where the symptoms aren't severe enough for you to notice.
Okay, but how do doctors confirm it's PCOS?
Good question. There's no single test. Usually, it's a mix of checking your symptoms, doing blood tests to measure hormone levels, and sometimes an ultrasound to see the ovaries. They also rule out other conditions first. Your healthcare provider will talk to you about your symptoms and medical history. Ask about your biological family's medical history. Take your weight and blood pressure. Perform a physical exam, looking specifically for excess facial hair, hair loss, acne, discolored skin and skin tags. Perform a pelvic exam to look for other causes of abnormal bleeding. Order blood tests to check hormone levels and glucose levels. Perform a pelvic ultrasound to look at your ovaries. Check the thickness of your uterine lining and look for other causes of abnormal bleeding. Typically, healthcare providers diagnose PCOS if you have at least two of the three symptoms. 1. Irregular or missed periods. Some people with PCOS have very heavy bleeding when they do have a period. 2. Signs of excess androgens such as acne or excessive hair growth, or a blood test confirming high androgen levels. 3. Enlarged ovaries or polycystic appearance of ovaries on ultrasound. Many people don't develop cysts.
Now that I know I have PCOS, is there a cure?
Not exactly a cure, but it can be managed very well. Your healthcare provider will determine treatment based on your symptoms, medical history and other health conditions, and if you want to get pregnant. Treatments can include medications, lifestyle changes, or a combination of both. For example, if you don't plan to become pregnant, treatments may include 1. Hormonal birth control. Options include birth control pills, patches, shots, a vaginal ring or an intrauterine device, IUD. Hormonal birth control helps to regulate your menstrual cycle. Some forms will also improve acne and help with excess hair growth. 2. Insulin sensitizing medicine, such as metformin, which is a drug used to treat diabetes. It works by helping your body process insulin. Once insulin is under control, some people with PCOS see improvements in their menstrual cycles. 3. Medications to block androgens. Some medications can block the effect of androgens. This helps control acne or hair growth. Talk to your healthcare provider about whether such treatment is right for you. 4. Lifestyle changes. Eating a nutritious diet and maintaining a body weight that's healthy for you can have a positive effect on insulin levels.
What if I have plans to get pregnant?
If you want to become pregnant now or in the future, treatment for PCOS may include 1. Drugs to induce ovulation, releasing an egg. A successful pregnancy begins with ovulation. Certain drugs have been proven to induce ovulation in people with PCOS. 2. Surgery. A surgical procedure can help restore ovulation by removing tissue in your ovaries that produces androgen hormones. With newer medications available, surgeons rarely perform this procedure. 3. In vitro fertilization, IVF. This is an option for people with PCOS when medication doesn't help with ovulation. Your provider fertilizes your egg with your partner's sperm in a lab before transferring it to your uterus.
So it's not the end of the world?
Not at all. Many women with PCOS go on to live full, healthy lives, and even have children if they want to.
So how does PCOS affect pregnancy and maybe menopause?
PCOS can make it hard to conceive while also increasing your risk for certain pregnancy complications, but many people with PCOS do get pregnant on their own. Your healthcare provider will work with you to develop a treatment plan to help you ovulate. Your treatment plan could include medication or assisted reproductive technologies like in vitro fertilization, IVF. The hormone changes you experience during menopause often resolve the symptoms of PCOS. It doesn't matter how old you are, if your symptoms affect your quality of life. Talk to your healthcare provider.
To be honest, the hardest part for me has been the emotional side. Seeing my skin break out, struggling with weight, and people making comments. It hurts.
I completely understand. PCOS isn't just physical, it affects self-esteem, relationships, even mental health. That's why support groups, counseling, and talking to loved ones are so important. You're not alone.
That really means a lot. Sometimes just hearing someone say you're not alone makes a huge difference.
Emma, your diagnosis doesn't define you. With the right care, mindset, and support, PCOS can be managed. Remember, You are more than your condition.
Thank you, Dr. Grace. I feel lighter already. I think more women need to hear this.
For anyone watching this video, if you suspect you might have PCOS, please don't rely on Google alone. See a healthcare professional.
And share this video with your friends, sisters, cousins, because someone you know might need to hear it.